Hello, this is Ellie Hammond, clinical exercise physiologist with Ohio Health Cardiac Rehabilitation. And today we're going to be talking about the electrical system of the heart, which is part 4 of our Anatomy and Physiology of the Heart series. The heart is a very complex organ. You may have heard this comparison before, but the heart is similar to a house in that it has a plumbing system and an electrical system. So today we're going to be talking about that electrical system. So when we're talking about blood flow through the heart, the coronary arteries and the veins, that's the plumbing. So everything we've talked about up to this point is the plumbing of the house. We're going to be talking about the electrical system today. So it's a separate but an equally important part of the cardiovascular system. The electrical system of the heart is what controls the heart's rate and rhythm. So that's 60 to 100 beats per minute at rest, hopefully, and the heart rhythm, which is just hopefully a normal rhythm. The electrical that it controls this originates at the sinoatrial node or the SA node, which sits right on top of the right atrium. So when the heart is beating as it should, we call this normal sinus rhythm, or NSR for short. We call it sinus rhythm because that impulse is originating from the sinoatrial node. Anything other than a normal sinus rhythm is referred to as an arrhythmia or an abnormal rhythm. Some arrhythmias are mild, you may not be symptomatic, and they don't necessarily cause reason for alarm, while other arrhythmias are serious and can possibly be life-threatening. So today we're just going to talk about a few common arrhythmias. There are a lot of different arrhythmias, but these are some we commonly see, especially in cardiac rehab. So tachycardia is just a faster than normal heart rate. A normal resting heart rate is between 60 and 100 beats per minute, and tachycardia is anything above 100 beats per minute at rest. So we do expect it to go up with exercise, but tachycardia is when that heart rate is over 100 beats per minute at rest. Bradycardia is the opposite. It's a slower than normal heart rate, or less than 60 beats per minute at rest. In cardiac rehab, we're a little more lenient with this bradycardia because we have so many patients that are on medications that will lower that resting heart rate, sometimes less than that 60. So if it's in the 50 beats per minute range, we're usually not too concerned. Atrial fibrillation is a very common problem, especially with our heart attack patients. This is an arrhythmia that causes the atria to beat erratically and out of sync with the ventricles. So some people in AFib are not symptomatic, but others may have shortness of breath. They may feel palpitations or even fatigue. AFib does increase your risk of stroke and heart failure. For some patients, it's paroxysmal, meaning it comes and goes. So you may not always be in AFib, but under certain circumstances, your heart beats in AFib. Another common problem, especially with exercise, is supraventricular tachycardia, or SVT, also referred to as paroxysmal SVT. And this is when abnormal electrical impulses trigger an abnormally fast heart rate. So you may be exercising, you may be at rest, and the heart rate just takes off on you. So when this occurs, the ventricles don't have enough time to refill with blood properly, and this may lead to you feeling dizzy or lightheaded. Premature ventricular contractions, or what we call PVCs, are abnormal contractions that begin in your ventricles. These contractions occur before the next expected beat, and it can disrupt the normal order of pumping. Some patients don't feel PVCs, others might feel a skipped beat or like a fluttering sensation. And PVCs are very common after heart attacks and in patients with heart failure. But they can be made worse. So if you drink a lot of caffeine, or if you have a lot of anxiety, or if you're a tobacco user, these PVCs are more frequent. There are a few different treatments for arrhythmias. There are a couple procedures that can be done for patients who are symptomatic with their arrhythmia. So a procedure called an ablation is where a portion of the cells causing that abnormal rhythm are destroyed or scarred just to prevent those impulses from entering your heart. A cardioversion can also be done, which is where the heart is shocked back into a normal rhythm. Medications are commonly used, things like beta blockers and calcium channel blockers, as well as anticoagulants can reduce your chance of stroke if you have an arrhythmia. Pacemakers are devices that can be implanted that will take over the rate control of the heart. So remember, our normal pacemaker is our sinoatrial node, but an artificial pacemaker will take over that SA node and control the rate of pumping. Some pacemakers are called demand pacemakers, which will allow your normal SA node to function. And then if it drops below a certain beats per minute, usually about 60 or so, that artificial pacemaker will take over. ICDs are another option, an implantable cardiac defibrillator, and an ICD will deliver an electrical shock if it detects a life-threatening rhythm. Sometimes a pacemaker and an ICD will be implanted at the same time. So those are different options. That's not to say you will have all of those if you have an arrhythmia. Usually medications will be the first line of defense. And then if you're symptomatic after that, there may be other interventions that can be done. And that concludes part 4 of our anatomy and physiology section. Thank you.